right. Yeah.
Already. And what is she saying? About 2 weeks, they might have more information on where this single shelter is going to be.
Right on. Let's just move right along here to Department of Public Health and Social Services. He is the acting Chief Public Health Officer, Chima Mbakwem. Good morning, Chima. Unmute.
Morning, Chris. Morning, Sabrina.
Good morning.
Morning, Jason.
Good morning, Chima.
Right on.
Okay.
Well, let's just get right into it. Chima, with the vaccine verifications, we're just hearing from a lot of people about what's the status with getting those processed. Is there a backlog? Because that's what we're hearing.
You know, like when you start something new, there's always challenges, and then you get through it. So that's how I'm going to start. You know, when the verification was discussed, it wasn't in effect right away. So public health on our own side was actually getting ready to set up a system for the verification, and then people started calling in. But as of today, we already have a plan in place that is being rolled out, and we're working with a few partners, and we have some other strategies that we have in place to reduce that backlog. So by Monday, we're going to make an announcement, hopefully how people can get their verification easily, and there won't be backlogs again.
So currently, though, because this new quarantine protocol goes into effect at 12:01 tonight, and it is based upon verification, how does this work for them?
For the inbound passengers,
right, that are from Guam, that is public health going to be stood up over at the airport with their computer and can easily verify whether or not someone from Guam returning to Guam has been vaccinated?
Yes, I hope I'm not jumping the gun, because I just came out from a meeting with my director, and that was
jumping the gun is issuing an executive order without guidance.
But, yeah, the guidance is actually ready, but we just need to go through it one more time. I left the office like midnight yesterday with the director and the team, making sure we had everything in place. And then the legal counsels are looking at it one more time before we put it out there, because what we found out is that over time, the mistakes in the guidances are actually addressed in the court. So that's how we find out that maybe we just didn't dot an I or cross a T. But right now we're trying to make sure that all that is in place. But for inbound passengers coming in on Saturday, Public Health has a system in place. And the system is, we're going to have individuals from the immunization team who are trained to access the WebIZ. So when you land in Guam and you don't have you have your vaccine card, but you don't have your verification, you go to the public health official at the airport that will go through your WebIZ, identify your name, print out your WebIZ, and then hand it over to you to go over to the other screeners to get cleared. So that way, we have identified 20 individuals that will do a 24-hour shift for a week to handle the flow, and then to gauge, if we need to upgrade or we need to downgrade. But we actually had that meeting yesterday with the airport team, and we're starting. So the individuals are going to be trained this morning by 11 a.m. on how to process at the airport, and then we'll do a dry run later this evening in preparation for tomorrow.
Okay. Well, that's good to hear, because I know that people that are probably returning from Guam that are like, oh, there's this new quarantine protocol. I'm fully vaccinated. I got my card, but wait a minute. I'm still going to have to go into quarantine. So it's good to hear that you guys have something set up at the airport where they're not going to have to go straight to the quarantine facility and wait that extra, 1 or 2 days, right? So The other question then that I had is for people that are currently in the government quarantine facility, I guess you could say, and they are fully immunized. At 1201, is there also some sort of a system in place at the QFAT where they could be released?
Definitely, so we are not deliberately locking people up, like I always say, it's a preventive measure. So if the EO comes in place, and that will be at the discretion of the director, but we already have a system in place. So we just need him to tell us, to go ahead. Then we already have that system in place. And I'm optimistic that that's what we're going to do. But like I said, I don't want to jump the gun until things are fully announced.
So is that a yes or no? I'm not sure what that was. We just have to wait. We have to wait until the press conference is held?
It's a subtle yes, but I don't have that authority to firm it up, but I think it's the right thing to do.
Okay, what about for those that are in home quarantine then, that are fully immunized as well?
So now you're looking at two different things here, right? So if you are in home quarantine based on travel, that is different. If you're in home quarantine based on close contact to a known positive case. So these are two different scenarios. So for the travel related, like I said, they might get the extension of that release, based on vaccination, but also are identified as close contacts to active cases will not be allowed to leave quarantine. So these are two different scenarios. Yeah.
All right, so just for clarification, because there was some background noise, if you are on home quarantine and after recently traveling, you completed your 6 days at the government QFAT facility, you tested negative, you're in home quarantine, you might be eligible under the new quarantine protocols. If you're fully vaccinated, you would be able to be, I guess you could say, released from home quarantine. But if you are in home quarantine because you're a close contact to an individual that tested positive, then no go, even if you are fully vaccinated.
No go, yes.
Even if you're fully vaccinated?
Yes.
Okay, got it. All right. So then will that be in the public health guidelines when it comes out, whenever public health releases it? Those sort of clarifications.
So, like the guidance is addressing the future, not the past. So the guidance is where we're going to. So if we're looking at it retrospectively, we're going to now put into consideration those who qualify based on the new guidance. So that's what we're looking at. So if you came in maybe on Wednesday, you're fully vaccinated, you're in the quarantine, and then the new guidance is released. The chances of you being released from quarantine is high, right? Based on the new guidance. So that's how we're looking at it. But it's something that I have to wait to be announced. But all these are in good faith, to do what you're asking, and we know that, and we are working towards that. But that won't be part of the guidance, because the guidance is looking forward and not looking backwards.
Okay. Do you know when this guidance is going to be released? Because there's so many people who have so many questions. And
yeah. So we worked on it until midnight, or this morning before we left, and the director is actually in a meeting, so maybe it will be signed before noon today. If everyone. The legal councils are reviewing it, and then the public health reviewed it yesterday. So we're just trying to make sure that, we get it right. We're looking at the legal implications, we're looking at the public health, and then we're looking at public health and population safety too. So we're trying to make sure that we balance all that before we release.
Okay. So Chima, because we have you, we know we talked to Dr. Hoa earlier, so I wanted to kind of go through some of the questions that our viewers had with regard to if I am fully vaccinated and I arrive on Guam and I have the verifications that have been requested of me by public health, but yet I have a minor and I have my child traveling with me. Are we still good to go to bypass quarantine, including my kid?
Okay,
That's not vaccinated.
So we're looking at the scenarios there. So you're fully vaccinated, your child is not vaccinated, and you're
Arriving to Guam.
You're
I'm at the
arriving to Guam.
airport.
Yeah, you're going to go home, yes, but your child will be in quarantine at home,
Okay,
or
at
your
home.
lodging, yes. But we're not going to put you in the government quarantine based on your child. But your child is going to go home with you and be quarantined at home.
Right. Chima, we also have
Okay,
one here
so-
from Francisco. I've emailed public health and no one has responded.
Okay. So, Chris, we hear this and we try to address it. As at yesterday, we had 900 emails. As at 8 a.m. when I had my meeting with Annette Ogon, they had 900 emails that morning, and nothing changed from their staffing. So these are the same people dealing with the daily vaccination. These are the same people dealing with the immunization ports, right? So that is number one. Number two, you have 10 phone lines that people are calling these 10 phone lines at the same time. So imagine 10 phone lines being called by 1,000 people. You can continue calling until you get the chance. So we identify all these challenges and we're working around it. So yesterday I actually had a discussion with the team about how to provide more manpower and more email addresses. So we're actually collaborating with UOG, the call center. Already they have 5 individuals supporting us, and then they gave us 5 phone lines. And we're also sure that they actually told us that they can give us up to 17 if their workload is less. And then yesterday, like I said, I had my team identify 20 more people that will join this process. So we're working towards making sure that everything is in place. But like I said, at the beginning, there are these challenges. It's new. We're trying to figure out how best we can handle it.
Chima, so those who are not vaccinated but arrive with a negative PCR test are going in the quarantine, correct?
Yes.
Okay, so are we going to scale back the size of the quarantine facility in anticipation of having to quarantine fewer people?
That I cannot answer because we need data to make that decision. So we're going to look at what will happen in the next few weeks, and then we'll be able to make that determination.
Chima, I wanted to ask, if you are not from Guam, but you are coming into Guam and you have to have that the verification, right? If you're fully vaccinated, how is public health going to determine whether or not the verification that they received is actually legit and it's not fraudulent?
Okay, so let's imagine you work for the Department of Defense and you are a TRICARE patient. Your immunization record is unique. So you get your vaccine card, which is a CDC issued vaccine card, or a receipt from a pharmacy that actually the pharmacy where you got the dose of your vaccination. When you arrive on Guam, your TRICARE medical record is consistent with every TRICARE medical record, which is your immunization record. So it's going to have all your immunization on it, and then have your COVID immunization. So it's easy to identify those immunization records. Like most states in the US actually use the WebIZ. A few states use different immunization records, right? And Annette's team, is actually working with other immunization programs, that do not have the same immunization records, to find out what kind of immunization records that they have, so that if it gets presented here, we're able to verify. And I can take you back a little bit. When we started the quarantine for individuals coming in with negative test result, we were initially challenged because we got a lot of different test results, especially from California, that did not have the requirement that public health needed to allow people to come in. And what we did was we directed these individuals to the quarantine site, but called those health departments to confirm that those individuals actually had their test in those places. So over time, we were able to establish that form is consistent with California. So when you now present it, we accept it. So we're still going to have that little snag, to make sure that we do it correctly, and that's why the quarantine is there, so that we have that stopgap of 2 to 3 days to make sure that we get the right information. And part of the wordings of the new guidance is that the individual would have to assist us in getting that information. So if it's a personal medical record that we don't have access to, and we need to get it from you, you need to help us, to get it. So those are the approaches that we use to counter these challenges when we see.
And Chima, can you just clarify that in the guidance that's going to be issued by Public Health, the only acceptable vaccines are the ones that are FDA authorized? So we're talking about the Johnson & Johnson, the Moderna, and the Pfizer. So if somebody comes in from the Philippines and say they got AstraZeneca, no, you're straight to government quarantine, right?
Yes.
Yeah. And Chima, let me just, for point of clarification, Rosemary comments in, so this new directive is to allow travelers to quarantine at home. How many days must they home quarantine? Actually, so for fully vaccinated individuals who provide the verification and the secondary verification, they're going home, not to home quarantine, right? They're just going home and they can do whatever.
Yeah, but they have to be monitored by public health for symptoms for 14 days.
And so is that going to be, does that mean that, okay, I'm fully vaccinated, I'm out of the quarantine, come back from a trip, I'm out and about, public health is what? They're going to call me and be like, hey, do you have a temperature? Or, hey, how you feeling?
So public health has an electronic monitoring system. So what it does is that it sends daily checks to you, either via email or web text or phone call. So when you get those calls, you report in your symptoms, and then we check it. So we have people checking those check-ins every day. Right. So if there's a red flag, we call the individual, and then we always advise them to go to their medical practitioners, so their clinics or their providers, or go get a test from any of the public health testing sites if they have any symptoms.
So that's mandatory, where you have to sign up for the SARA alert?
Yes.
Okay. And I just got to say this, Chima, just so that you're aware. So I did sign and I put my email down for the SARA alert to receive it via email to get those daily checks, right? So I think I only got it one time via email. Mm-hmm. So the SARA check-in, whatever. But I hadn't gotten it Thursday and Wednesday, Thursday, and Friday. I think I didn't receive the check-in. So, but what I did on my own was I just went back to the initial email and I just clicked, no symptoms, no symptoms, no symptoms. So I don't even know if public health is getting that. So just so you know, I'm not sure what's happening there.
Someone gonna get in trouble.
No. I don't know if it's like automated.
Yeah.
It's automated. It's automated, and good thing you're telling this to me. I can actually work with them. Most of the time you might be getting, you might check your spam email, or did you give them a phone number?
Yeah, I gave them phone number and my email, but I requested that I get it through my email. And so I got it the first day I was out. And of course, I submitted no symptoms. So since Wednesday, I haven't received any other email from this Sarah Alert program, but I just went back to the initial email and I just kept clicking every day that I had no symptoms. I just don't know if it's actually going through.
Yeah, I'll definitely take a look at, and these are the kind of feedbacks that we want, because working with the Sarah Alert team, the development team, we have these weekly, bi-weekly meetings where we present these kind of challenges and they're quick to fix it. Because for us here on Guam, the Sarah Alert system is what we're going to depend on, over a long period to ensure that we're safe and do population monitoring. So this is a good feedback for me, and I'm going to really check it and get back to you.
All right, Chima,
Okay.
I just wanted to ask, just because I do see some people kind of echoing the sentiment in the comments, but even though people are fully vaccinated, the messaging from public health and the governor has been to continue doing the things that we need to do in terms of, washing the hands, wearing the mask, watching the distance. So how do we kind of reconcile that with this new policy that allows fully vaccinated people to just be released into the wild upon arrival?
So you're looking at it from two ways. We're looking at the island being protected by vaccination, right? So that's why we're trying to increase vaccination on the island. At the same time, we're allowing people who have that same level of protection to come into the island. So right now you have individuals who are protected from getting sick, adhering to public health recommendations, which is keeping your safe distance, wearing your mask, and washing your hands. We didn't say stop. And if you remember, these three strategies was what actually got us to where we are today, right? So the added level of protection is the vaccine. But so one does not substitute the other. They have to work hand in hand. So while you are still vaccinated, you need to make sure that you adhere to those recommendations for us to continue being safe, because there is no cure for COVID. And there's still the chances of someone who is infected, vaccinated, asymptomatic, infecting someone else. But if you are vaccinated and you're exposed to someone if you're vaccinated and you get exposed and you get infected, chances are that the vaccine will make you not get too sick to get in the hospital, and at the same time will make sure that you might not die, but at the same time there's a chance for you to get infected, even if it's 1 in 500. There's that chance. So that's why we are still sticking to the recommendation of mask wearing, washing your hands, and keeping safe distance.
You said mask wearing.
Yeah, and people should open their windows,
Yeah.
Chima,
You said mask wearing, Chima, and the CDC just came out with a guidance this morning that Dr. Hoa Wen called controversial. This guidance, fully vaccinated people don't have to wear masks. Indoor, outdoor, whatever door they're at, they don't need to wear a mask.
So yeah, so like Dr. Hoa said, it was controversial. Yeah, science can come either way. But the thing is, they have enough data to go the route they are going, right? And make those, and basically those are recommendations. It's just recommendations for people to follow if you want to follow it. But here on the island, our recommendation is to continue wearing your mask, because right now we still feel that we've not gotten up to the level where we can ask people to take off their mask. So it's about recommendations and then looking at your risk level and seeing what is okay for you. Like when you want to cross the road, you might be smart, you want to cross the road, you just look left and then you dash across and take the chance. Some other person will look left, right, and left again, So it's a choice you make. But for us here, our recommendation is to continue wearing your mask.
Okay, Chima. So I wanted to just go through this, make sure it's just in complete layman terms and people understand it. I am coming to Guam. I am a returning Guam resident and I am fully vaccinated. I'm coming in on Saturday, tomorrow, right after this new quarantine traveler program goes into effect. I arrive tomorrow, 5:30 p.m. And again, I got my CDC card. I'm going through the baggage claim, then boom, public health is there. Public health will have their computers open because obviously I didn't have a chance to get the verification, but they can verify you on the spot when I arrive.
Yes.
Right? Okay,
Yes.
so I get the verification and I get to go home.
Yes.
I got the Sarah alert that you sign up for when you're at the airport, and then I get the daily check-ins. Other than that, I can go about my business.
Yes,
right?
and and for Sarah alert, and that's where we're going to have a challenge too, because people might give you wrong numbers. Yeah, we've had those situations. People are going to give you wrong numbers. People are going to try to beat the system. They'll give you wrong email addresses. There are people who just don't want to do the right thing. And these are the people that we're concerned about. Because, yes, and the team at the airport, we actually discussed another level of verification to call the number to make sure it works. If your number is not working, we're not going to let you out of the airport. Okay. Or you give us an email address. Yes, because so this is what I discussed with the team yesterday. We need to be a little stringent, because we're opening up the island. And if we're opening up our island, we need to make sure that individuals are there to our recommendations. We don't want people using it as an option to just get into the community and say, oh, I'm in the community and I'm off public health. They should also remember that we have their home addresses on those forms. And we have a compliance team. If you're not checking in, we might have the compliance team come pay you a visit. And so this is just to make sure that the community understands that we're opening up the island, but we are still vigilant. Public health is still vigilant. We want to make sure that people remain safe. We don't want to open the island for people coming in from travel to come in with that impression that they can just walk in and just walk away. We just need to make sure that we continue monitoring them for symptoms until they are past their 14 days and then everything is okay.
Okay, but if you're not, go ahead.
No, okay, so the other scenario then is if I'm in the government quarantine facility right now and I still have a week to go, let's say, but I'm fully vaccinated, I can call the number on the sheet, public health, hey, I'm fully vaccinated, can I be released? And they can pull it up on the computer system and they can say, okay, you're good. And you can go home.
We have people in the quarantine site that will be trained, that will be part of the training this afternoon. That will have that ability to look up that information for verification. So we have that covered too.
Okay, but if you're not fully vaccinated and you're coming in with a negative test or no test, you're going into quarantine.
Yes, remember that fully vaccinated is 2 weeks after one shot.
Yeah.
So I think that definition is important for whoever is coming in, so that people don't get vaccinated, jump on the plane and run back home, thinking that we're going to let them in,
Chima, so let me ask, with the critical service worker exemptions, if a critical service worker is flying into the island not vaccinated with the negative test, they have all the other paperwork, are they going to be granted an exemption even if they're not fully vaccinated, or what's the status of that?
So remember what we were doing with the critical service workers before. They were on a strict restriction of movement, but they come in with a negative test result. They're monitored daily and they're on restriction of movement. But with this new guidance, what is clear is that if you're fully vaccinated, you come into the island. So the critical service worker is out of the window, right? Because you can come in like every other person that is fully vaccinated. But if you're a critical service worker that is unvaccinated, but remember that is a critical care worker. So at this point, we now have to look at how critical your work is. if you're the only guy who can do that, that is critical. But if someone else can do that, then we might have to look at it twice, you know.
Wow.
So I think yeah. So we really need to have a balance, because the whole reason for this is to make sure that people are vaccinated so that others will be protected. So is a choice. If it's your choice not to get fully vaccinated, then it's gonna be a choice, you know, for people not to get exposed to you. So we have to balance that.
Right. Do you have enough personnel to go and check on everybody?
Chris, we don't have enough personnel to check on everybody, but we have a system in place that to make us check everybody that needs to be checked.
Okay. Chima, I don't know if you know the answer to this, but I did get a request. Somebody's asking, do you know if Department of Defense Joint Region is also going to be modifying their quarantine protocols to reflect ours? Oh, what happened? I think we might have lost Chima. Well, yeah, Bree, did you get any questions about that? DOD Joint Region? Oh, he's coming back in. Okay. Hi, Chima. Your internet's probably all because people are emailing to get their vaccine verification. Stop emailing until after the interview, guys. No, but have you heard anything from Department of Defense Joint Region on their protocols and if they're going to modify it to reflect ours?
On their what?
On their quarantine protocols, are they going to be adjusting their protocols to align with ours?
Yes, and the good thing is we actually work hand in hand with them when we change these guidances. So they sit on the table and then we go through their plans. Because what GRM has been able to do in the past year is to work closely with public health and align their policies to public health policies. So it's always an ongoing collaboration between public health and GRM to be in line. So they will definitely go with us on whatever we're doing.
Chima, I had one question with regard to this is it WebIZ?
Yes, WebIZ, yes.
All right, so public health that has all these partnerships with these private clinics, with these pharmacies that they're giving vaccinations to. So ideally, because they have access to this WebIZ, could people that have gotten vaccinated, say I was at the UOG Calvo Fieldhouse, I got vaccinated there, could I go to a private clinic and say, hey, I'd like to get a verification? Can you print one out? Here's my card.
You didn't get your shot at the clinic, so you don't have to go there. You need to go to the public health. So what you need to do is go. If you got it from a provider, you can get it from the provider because they have access to that information. But public health is the main repository for all that information, and then you can get it from public health.
Right, but do these private clinics? Sorry, there's just a lot of noise in the background. These clinics, these private clinics, do they have access though to this WebIZ? To all the vaccinations. So I'm just saying, could I go if I got mine at the Fieldhouse? Could I go to a private clinic or a pharmacy or wherever that offers vaccinations? Couldn't I just go there and ask, hey, can you make me a printout?
I wouldn't advise you to do that because they wouldn't even do it because they're not the ones that give you the vaccine.
How about if you got your vaccine at AMC and you call AMC and say, hey, can you know?
Yeah.
AMC is not going to give you a vaccine card that they did not administer. So
no, Chima. If we did get the vaccine at AMC, can we call AMC or any clinic and say, hey, can I get my verification from you guys?
Yes, you can get it from there. Yeah. Okay.
So that's going to ease some of the backlog with public health that people know that they can, whatever clinic they got it at, they can reach out to that clinic and get a copy.
Yes, and part of registering to be part of the immunization is having access to the web IZ.
Yeah.
So I think it's the right thing for you to go to where you got your vaccination to get your verification.
God, we should have said that at the beginning.
But you can't just go to any clinic, right? That's
No, you can't go to any
yeah,
clinic.
yeah. Okay.
Right on. Anything else, Bree?
Just real quickly, again, home quarantine. If you're fully vaccinated, to get out of quarantine.
Would you stop already?
What did you say? I want to make sure I heard you correctly.
Yeah. Yeah,
If
Chima.
if you're currently on home quarantine,
Yeah.
and this new policy goes in at 12:01 this morning, and you are fully vaccinated, can you be released? Do we have to call public health?
No, you're not going to call public health. You're not going to call public health. Just wait for public health to call you.
Oh, great.
Or wait for the director to say something on radio. But,
well, let's just get the director.
All right, I'll wait.
I'm sorry, Chima, that my colleague is trying to use this for her personal.
Oh, come on.
I know.
No, but you see, the good thing about Sabrina
I'm not
is
the
that
only one.
Sabrina is law abiding. That is the most interesting part.
Yeah, she is.
Seeing her in quarantine was a shocker for me. I'm like, whoa.
Yeah, I know. Yep,
If you
a little too law
every
abiding.
other person should do it.
I'm doing my part.
Yep. If there's anything I say
you
about
are.
Sabrina, it's she's by the book. That's for sure. Chima, thank you.
Awesome. Thank you so much.
We're gonna let you go because people are calling public health, and you're here, and they probably needed to go answer the phone.
That's why they shut down my system.
Trying to give you a hint. Get your ass out here and answer the phone, Chima. Thank you, Chima.
All right, thank you, guys.
Right on.
Okay.
There you go.
Thank you.
It's all hee hee ha ha now, isn't it? Yep. No more quarantine. Party time. We're gonna take a quick break right here on the link. It's 9:23. Good morning.